Hello and thank you for taking the time to listen to my video. Let's get started. Chronic obstructive pulmonary disease is a chronic disease that affects your airways. COPD is a long-term disease that gets worse over time and is identified by typical traits such as inflammation and severe limitation of the lungs. In normal functioning lungs, when air is inhaled, it travels down your windpipe and into your airways, which are also called bronchial tubes. Inside your lungs, the airways branch out into smaller and smaller tubes called bronchioles that contain a high concentration of blood. At the end of these tubes, there are countless air sacs called alveoli. Normally, the walls of the airways and air sacs are elastic and easily flexible. When you inhale, each air sac fills with air, and exhaling causes the air sacs to deflate, pushing the oxygen into the blood. This process allows for proper oxygen intake into the blood to be brought to the rest of the body. However, those with COPD, like yourself, have airways that are thick, inflamed, and high in mucus, which is extremely abnormal. This mucus further disrupts airflow and makes it even more difficult for you to breathe. Furthermore, the air sacs in your lungs are also damaged. They lose their flexibility, shape, and the overall quantity and capacity of the air sacs goes down. With there being less air sacs, your body will now have a more difficult time distributing oxygen to the rest of your body, making it again more difficult to breathe. Additionally, the fact that there are less air sacs means that your lungs will have a more difficult time deflating like normal, which makes it harder for you to get fresh air. Before we dive into treatment options, I want to take the time to explain why we are here. COPD numbers increase annually as a result of smoking and pollution. However, in your case specifically, it is most likely due to your smoking habits. Smoking is the number one cause of COPD at the moment. Even secondhand smoke, along with other everyday pollutants, can be cause. At first, COPD may cause no symptoms or extremely mild symptoms, but since this is a progressive disease, it worsens over time. You start exhibiting typical characteristics such as shortness of breath, wheezing, chest tightness when you physically labor, and a thick smoker's cough. If COPD is not treated, the progression of the disease will only make breathing harder and everyday activities will be more challenging. Furthermore, you may begin noticing you are more tired than usual. You might see weight loss, you might see muscle loss, and you might see lack of energy overall. This is why we must start treatment as soon as possible in order to help you maintain the lifestyle you deserve. Our goal for treatment, unfortunately, does not include a cure, as there is not one at the moment. However, with proper diet, exercise, and medication, we can begin to see vast improvements. We will begin to see your current state of COPD affect you less, make this disease progress as slowly as possible, improve your stamina, and improve your overall health. Furthermore, we go through the trouble of informing you exactly what COPD is and does, because if we do that, you are more likely to see positive results. Firstly, you must avoid smoking at all costs. I know you're a lifelong smoker, but we need to focus on your future. If you continue smoking, the chances of you seeing improvements lessen significantly. Secondly, avoiding all of the air pollutants when at all possible is also key. These two are responsible for making the effects of COPD worse for you. However difficult steps 1 and 2 may be, I'm going to need you to do your absolute best to heed my directions, as it's for your own benefit. Your final step for today is going to be getting acquainted with your new inhaler. It's a bronchodilator, which dilates the pathways in your airways to make it easier for you to breathe. In order for you to use your inhaler, you will need to make sure you use it properly. The first thing you need to remember is this: always inhale your medication slowly, deeply, and consistently. You might think that a fast and powerful inhale would only get that medication into your lungs faster and get you where you need to be for that day. However, I can assure you that breathing slowly, deeply, and consistently is the best way to ensure you see maximum benefit from your inhaler. If you remember anything from how to take your medicine, try thinking, slow and steady keeps my lungs open and ready. Finally, you're probably wondering, well, at what stage in the breathing process do I actually release the medication for inhalation into my lungs? Well, to answer your question, I will tell you to do 3 things before you actually release the medication from the inhaler. 1. Put the mouthpiece between your teeth. 2. Make sure your tongue is flat on the floor of your mouth and not blocking the path of the medication. And 3. Inhale about 1/4 of the way into your breathe-in process. This way, the medication seamlessly flows with your normal airflow and you see maximum results. Thank you for taking the time to educate yourself today about your newly diagnosed case of COPD. I hope this video informed you and answered your initial questions. My phone is always on if you have answers that need a quick response, but always remember that 911 is for your emergency cases. Thank you.